Welcome to the Fireside Chat with Pauline Williams and Flic Gabbay. Today is the International Day of Women and Girls in Science. And as a scientist myself, I'm very delighted to be introducing this Fireside Chat. I just want to also say something about an initiative that we launched today with the Medical Women's Federation. And it's called Keeping Women in Health. And this seeks to address gaps in women's health. So keep an eye on for some of the activities that we will be planning with regard to that. We've also launched a new project called Women in Pharmaceutical Medicine. And this project will look at the challenges women face in their careers. And I'd like to thank the Royal Society of Chemistry, who gave us £10,000 towards the project. So without further ado, I will now turn over to the chair, Dr. Flic Gabbay, the Vice President of the Faculty of Pharmaceutical Medicine. Flic.
Thank you, Marcia. And I am absolutely delighted to welcome Pauline Williams as our guest today, especially on this day of women and girls in science. Pauline has been through corporate big pharma in a way that is really impressive, leaving a trail of innovative legacies behind her, and approaching things in a slightly different way, which we're going to hear about. Well, she's currently Senior Vice President and Head of Global Health, something that is really quite important at the moment, but was Head of Maternal and Neonatal Health, and also was at one time setting up the academic GSK drug discovery partnerships, which is has been an example to many other companies in industry, but was one of the major forerunners. She has been both mentored and has mentored on her way through her career. She is a fellow of the Academy of Medical Sciences, and in this year's honours list, received a well-deserved CBE. So, wow, I'm slightly awed, or more than slightly awed, and congratulations. So I guess my first question is, when you joined the pharmaceutical industry or you became a doctor, did you expect your career to end up here?
No. Well, I mean, I never expected to end up in the pharmaceutical industry to start with, Flic. Well, first of all, thank you for hosting this. And you talk about sort of leaving a trail. It makes me sound like a snail, which at times it did feel like. But no, I think when I became a medical student, fully expected to go into a career in either hospital medicine or general practice, and fell into the pharmaceutical industry somewhat accidentally, if I'm honest. It was a 6-month opportunity to work in a CRO, a phase 1 unit in Leeds, and it was just filled a nice 6-month gap that I had, and happened to be co-located with where my fiance was living at the time, and but absolutely became hooked on pharmaceutical medicine, and joined Glaxo after 6 months actually. And no, I don't think I ever really thought that far ahead to think that, you know, after 25 years plus later, I'd be sitting here talking to people about my career. So I guess it's just been a surprise all along the way.
It must have been amazing to get your CBE. How did you celebrate?
I have to admit, I mean, we get so many phishing exercises, you know, to avoid being scammed and cyber attacks. I genuinely thought it was another one of these, and didn't want to click on the link because it was just a quite inauspicious looking email. But once I'd established it was, you know, real, I did open some champagne because you're not allowed to tell anyone, so I had to sit on it for, well, it's actually only a few weeks. I only just learned just before Christmas, so whether I was sort of last minute shoe-in, I don't know, but it was lovely and completely unexpected. So yeah, I feel very honoured and a little embarrassed because there's so many, you know, other people that are deserving, and also feel that I'm getting rewarded for work that a lot of my colleagues and team members have done. So I hope that I can reflect their contribution as well.
I think that is really something that a lot of people in science do say, you know, that when they get awarded things, it is on the back of things from other people. But I think that's particularly something in pharmaceutical medicine because we work so much as a team. And I wonder, you know, you said that you kind of fell into pharmaceutical medicine, but did it ever occur to you when you were, before you got into pharmaceutical medicine, that that might be something you would do? Did you know it was a specialty even?
No, I didn't. And, you know, and I think, you know, going through medical school, the only interaction we really had with the pharmaceutical industry was the sort of, you know, the leftover freebies and the meals from when the reps came to the hospital, actually, and the medical students would sort of go in as gannets after the event. So, and I wish I had known, actually, and equally, I wish I'd known more about careers in academic research as well. I don't think we were really exposed to that, and looking back, I would have liked to have known more. And of course, in those days, in the 1990s, there was still a sense that you were selling your soul to the devil, and a bit of kind of mistrust almost, in the sense that if you were automatically becoming a rep because that's all you really were exposed to, and so that's why it was such a pleasant surprise for me when I did join, was just the rigor of the science, the opportunity to really see that line of path to the patient, and the recognition that you could have a very significant impact clinically in just a discipline that so many of my friends and colleagues had no idea about. Yes,
no, I think that's quite funny. When I joined the pharmaceutical industry, people said, why did you want to become something other than a doctor? And I pointed out my job was to sign prescriptions largely for the whole country. Was that not medicine? You know, it's a very different thing, but I think very rewarding. When we were having a few chats beforehand with Marcia and yourself, you talked about believing in yourself as being one of the biggest challenges in your career. And I think many people on this call who work in or have worked in corporate pharma will identify with the fact that sometimes it's actually quite difficult in a very big organization when you're a relatively small fish, and also you're female amongst there are a lot of very senior men in pharma still. We still know that whilst there are almost equal numbers of females overall, or even more females, that in leadership positions we're still lagging behind. And you said that believing in yourself was one of the biggest challenges. Do you want to just talk about that a little bit? Because you obviously achieved that and moved on out of some very difficult situations.
Yes, so I mean, I think I'm naturally quite an introverted person and quite a shy person, and a bit of a worrier, and I think kind of talked myself out of things quite a lot, and I think sort of, you know, compared my knowledge in certain depths in you know, in certain areas as it's not being as deep as others, and so I I think I let a lot of opportunities pass me by because of that, but was also fortunate that by virtue of reorganizations and being in the right place at the right time, was kind of propelled through different jobs to broaden my experience, but also had some really positive sponsorship from both male and female senior leaders who kind of pushed me into new things. And so I really did benefit from that, even when I felt a little uncomfortable and out of my comfort zone, to take on new projects over and above my day job, and to take on line management, for example, which I have to say I didn't enjoy to start with. I love it now, but I think that was quite a big step for me, and I felt quite irritated that suddenly I was being kind of interrupted by all these people that needed my attention. And I wanted to kind of get on with the stuff that I was working on, but kind of got over that. But yeah, I think that self-belief did hold me back for quite a long time, and actually I think it took a fairly fundamental event to really get me to give myself a stern talking to, and that was when I was taken in. I was invited to see my boss at the time, and it was an anniversary, a work anniversary, and I genuinely thought I was going to get a little certificate for how many years I'd worked in Glaxo, and it wasn't. It was my redundancy letter to say my role was being eliminated, and of course I didn't read it that my role was being eliminated. I read it that I was being eliminated, so I was really upset, and had a choice then as to, okay, well, what do I do now? And that was when I thought the opportunity to explore more about what we could do with academic partnerships came to play. And you mentioned that was a role that I then very deliberately created and made a business case for it, and that happened, and I think that was a real trigger point for me. I was about 40 years old at that stage, just to sort of benchmark it. I'm 53 now, and thought, right, okay, Pauline, you just got to control your career a little bit more and have a bit more belief and take some risks. So that was a pivot point for me.
Yes, I think that for lots of women, I think particularly and girls, this self-belief and being prepared to take some risks, because I think inherently we're quite risk averse and rather thorough about everything. We want it to be right, and I think that is really quite challenging. And I think maybe you could talk a little bit about the academic discovery partnerships, because you started off in that much earlier than most big corporates had their BD groups that were going out and maybe doing a bit of funding, and SR1 and GSK, of course. But actually the partnership thing was quite novel then and quite new. Do you want to talk a little bit about how challenging it was to set it up, because to get the academia to balance with your role in corporate pharma?
Yeah, it was interesting. I mean, it wasn't too much of a big step for me in terms of the original portfolio was very much in the translational space. So it was things that were moving from preclinical into first time in human and proof of concept. So that was the remit when we first started. And I think there was a kind of we started with Cambridge University and then extended out. And I think the academics that we worked with were genuinely intrigued. I think there was also that sense where their own metrics of success were also starting to link with ability to show translation of discovery as well, and so there was sort of learning curve on both sides, and it was a model of shared risk, shared reward as well. So a lot of skin in the game from both sides, and I think again that was an interesting discussion around no, this was not a contract that on either side that we were doing. This was, so there were no overheads. We were just putting our time in. We were joint, we had joint project teams, etc. And it was just a really exciting time, actually. I think it was starting to break down those barriers. And I think, you know, historically, I always had this view that academia saw big pharma as just one big checkbook, and me in turn had this view that perhaps academia was just sort of, you know, ivory towers and publications being the primary goal. And so to sort of break that down to really form really quite strong personal bonds, peer to peer, where the realization that we were here for the same reason, and that was to translate scientific breakthroughs into medicines, into patient impact. And then that was a successful model, and it extended to discovery, and that's where I really panicked, because I really didn't have the experience in that early kind of target validation space, and that was when actually my boss at the time was Patrick Vallance, who you probably see quite regularly on the TV now, and that was when I just said, I don't think I can do this, Patrick. I haven't got that early stage experience. I'm not credible. I don't really understand the sort of, you know, chemistry and lead optimization stage. And he gave me the best piece of advice that I've been given in my career, which was, you don't need to be an expert in every area to be effective at leading it. You just need to find the right experts in your team. And so I did recruit very carefully for that, and so that then became more of an international effort, and has evolved now to be quite embedded within the mainstream of what GSK does. And I think a lot of companies picked up similar models.
A lot of big pharmas followed suit. And I think that point about you don't need to be an expert is a big learning exercise, isn't it? That you make that transition from knowing about everything you do to knowing that actually you have to oversee some things you don't understand. and that's often very tough. And I think it's something that is important to crack. I have a question here that you know, around the number of women in pharma workforce overall. So in pharma overall, actually, it is 70% of women are represented across all the different positions, but only 20% of the leadership positions overall are held by women. It's higher in some companies. GSK is one. I think Sanofi is one of the only ones that has almost at par. But I think, what do you think we can do to support more women in leadership roles? Because I think it is important, all these things you've been talking about, we've got to learn how to emerge through corporate, and also for those people who leave into smaller biotech roles or come from academia into biotech now. After we're just talking about how it was largely one way, what you were just talking about, but in the future, there'll be quite a lot of people coming into pharma as leaders from academia as well. But how do we get more women into these leadership roles, either leading pharma or biotech?
Yeah, I mean, I think it's multifaceted. There's not one solution, and I think I can talk about my personal experience, and I think there's obvious ones in terms of for those with children is the opportunity for flexible working, and I had benefited from, you know, good maternity leave and coming back part-time after my first son, and I think that sponsorship that I talked about, I've also benefited from coaching and mentorship. I think being part of a community, you know, we have a women's leadership initiative in GSK, and I've also participated in external events where just sort of sharing experience. And I think having those role models, I think it's important to have pretty authentic role models who can say, you know, what their flaws have been and what hasn't gone so well, rather than the kind of, you know, superwoman. and I'd say that I have sort of benefited from real support in my career in terms of opportunities that have been given me. Equally, I would say that I've suffered from people. Well, I had one boss, for example, and I was a little frustrated that I could see all of my peers being given opportunities, and I was kind of static, and so I questioned it at one point, and she said, "Oh, it's because you've got young children, so I know that you haven't got bandwidth to do these things." And I was really furious, because she just made that assumption on my behalf, and she felt that she was doing me the biggest service that she could as another female leader, and having had children herself. And whereas for me at that point, it was actually the right time for me to advance my career. So I think there's that personal ownership as well. It's not, you know, what can everybody do for you, it's what you can do for yourself. And my advice would be to just make sure that people understand what your kind of aspirations are, and recognizing that can change throughout as well, so sort of keep that up to date and keep that networking going. So yeah, no, not a magic bullet, I don't think, but I think the more people can see female leaders, the less of a kind of big deal it comes.
Absolutely.
Yeah.
And I think the sort of informality of talking about it like you're doing now is really important. And I think if anybody asked me, the other thing is kind of bide your time. Actually, the thing I learned about my male peers who were promoted way ahead of me was that actually they fell over sometimes. I was given the opportunity to ground what I learned, because my career path was a little bit slower. And so actually in the end, it was an advantage to some extent. So I think one needs to have patience, but believe in oneself, which was what you said before. Let's just move on to COVID a little bit. It's affected everybody. Do you have concerns around women and the COVID? And I don't necessarily mean in terms of illness, but, you know, what lockdown has done to women and so on, and how do you think that's impacted, particularly from a career point of view?
Yes, I mean, this is a hot topic at the moment for a number of reasons. One, I sit on the MRC Council, and certainly that's been a big concern over the last year in terms of the disproportionate impact on female scientists who have taken the burden of the more informal work and the homeschooling as well, and that was on the backdrop of a gender inequality already. So the real concern that's just really setting it back, so that is a major concern. And I think then with my global health hat on, I was actually in a call that the Gates Foundation had organised yesterday, and Bill and Melinda Gates do an annual letter, and it's seen as, you know, everybody hangs on every word of this letter because they've got 50 billion to spend. And but Melinda Gates has really sort of escalated this in terms of the impact of COVID-19 globally, and the sort of the loss of part-time, lower-paid jobs, the majority of females in frontline healthcare worker jobs actually taking the brunt of a lot of the COVID impact as well. The increase in domestic violence, decreased access to contraception, prenatal and perinatal care in developing countries. I think there's going to be a real knock-on impact, not just on the health of women, but children and future generation as well. So I think all of this COVID situation has just magnified the gender inequality locally and globally.
Yes, no, I agree with you. It's very, and I think the contraception piece is very important. We work with a company developing a novel estrogen, and that is, I have all the guidance I'm downloading is talking about the impact on contraception of COVID, because people aren't going to clinics anymore.
Mm-hmm. Yeah.
And that obviously has a lot of impact. Let's just flip over to the people. I think we've got some teenagers on the call, actually, who I know some people's children are joining in, listening. And how can we get more people to be enthused by science? I mean, you and I have had fantastic careers and opportunities to develop things to make a difference and see them happening. And yes, of course, we do get paid for it, but actually, pharmaceutical physicians rarely retire because they kind of get addicted. How can we get more children addicted by the sort of scientific things that we do and see the rewards of them?
So, I mean, I think there is then, you know, if there is an upside to COVID-19, I would say that there has been more exposure to children in terms of the impact of science and the impact of the pharmaceutical industry in particular. And so, I mean, I think there is now a kind of platform that we can use. Again, to reference the Gates Foundation, they've run a Decade of Health campaign across the UK recently, and very much with attracting attention from young people to say, you know, this is what you can personally achieve. This is, imagine 10 years from now what the world could look like if you engage and use the tools that are now available. So, I mean, I think obviously the whole STEM outreach and what we can do to inspire children in school, and, you know, we've done work. One of my projects we did with the Big Bang Fair in the NEC, and just sort of using some examples to bring it to life, and you know, you can do pretty cool experiments if you're a health and safety team can allow children on site. And so and I think that there is a lot, and there's a story that we can tell, actually, and I think it's also something that, you know, the faculty can build on the work that you've done around just in the inspirational impact. And you talked about prescribing for the country, and I mean, I think making that link that the work that you can do could impact millions of patients around the world, I think is a really inspirational story. And that it just starts with one person being part of a bigger team, and then a bigger team. And so it doesn't become so overwhelming and aspirational that it doesn't, you know, you can't put yourself in that. I think it's telling the stories, actually, and getting more personal stories out there.
And I think it's extremely rewarding to be part of such a big team. I think those things are frequently very important. You know, no drug is invented by one person. It's invented by lots of people, and then the team gets bigger and bigger as it's finally developed. And it is incredibly rewarding, and to see, especially in corporate, when something is eventually receives approval and goes onto the market, how many people actually attend the celebration for that, and all the academics who are involved and everything. It is an extraordinary experience. So I think the more we can get out of there, the better. But is there anything else that you were saying there that the faculty could do a bit more? Is there anything else you think we could do to underpin the specialty in terms of getting the message out there about what an extraordinary career it is.
Well, I mean, as I said, you know, my own experience many years ago was just in medical school, just really not having line of sight of this as a career. And I think actually, and you've alluded to this as well, it was a bit of a one-way decision, that you kind of cut your bridges a little bit. And I think now is an environment where there's much more fluidity across sectors and disciplines. And so I think being able to showcase that as actually, you know, whether it's a sequential or a coexisting portfolio career, that you can really tap into that and explore the whole breadth of both, you know, clinical medicine, pharmaceutical medicine, and academic research as well. So I mean, I think much more case examples of where people have navigated that successfully, and the impact that it can have, I think. And you know, just a call out to the MHRA as well. I mean, again, I am an eternal optimist, and I said, you know, of all the bad things you could think about Brexit, the good thing was the opportunity of the MHRA to really stand out, and the regulatory science really come to the fore as well. And I think, you know, the recent examples have shown that very well. So I mean, I think that whole, you know, we talk about pharmaceutical medicine as a single term, but within that, the breadth of opportunity, the number of roles that you could consider or move through is astonishing as well. So I mean, I think that's something to bring out very strongly as well.
I think that's very true, and I think one of the questions that we discussed before was about the number of physicians coming through who want portfolio careers. Well, actually, this provides the opportunity to have all sorts of portfolio careers, because there are so many aspects of pharmaceutical medicine, from discovery right through to post-licensing, repurposing, working in different parts of the world, all sorts of things, many of which you've actually covered the whole breadth. But it is, I think it does allow people to have a great deal of flexibility. And I think it is actually, as far as environmental, social impact and corporate governance, it is a career that most pharmaceutical people do espouse the whole breadth of that, you know, novel ways of employing people, understanding how in their spare time they can do other things that also have social impact. I think it is an extraordinary career in that respect. And just as we start getting towards the end of the questions, I think Marcia wanted to know, if you had a portfolio career with something slightly outside of your job and all your other responsibilities, what secret talent would you like to explore?
I don't know. I'm asking myself that question at the moment. I'm just, as my Christmas present from my boss, he's organised for me to have some coaching, and we haven't started yet, but we had a bit of a kind of, you know, chemistry meeting as to whether turned out she was interviewing me, whether she was prepared to take me on, and as my homework before we start, she's asked me to really sort of write down what that could look like, in terms of if you could do anything outside of what you're doing now, what would that look like? So and I've really started to think about, you know, I don't know what my secret talents are, so that's probably just a sort of what doors could I open around that sort of creativity. I like writing funny little poems and comedy sketches and things, and I'm not, you know, I'd die a thousand deaths to be a sort of comedian on the stage, but I think I'd love to try my hand at writing something, and just, you know, I've accumulated a lot of experience, a lot of funny stories, and so maybe I could kind of channel that into something that could be inspiring for other females to think about, you know, my experience. But I don't know, that sounds a bit self-indulgent, but that's just
female farmer version of this won't hurt.
Yeah.
I think that would be, but I think there are many examples that in there as well, that female pharmaceutical physicians have of stories that they found themselves in big rooms of men or other places with men where it's been actually quite awkward, not many of which they probably like to articulate on something like this, but I'm sure it would make very entertaining writing.
Yeah, I mean, there's also, I mean, I think, you know, again, just in terms of what advice would I give? I mean, I think, you know, there's one example that was shared with me where apparently I was being discussed in a talent review at the kind of R&D leadership, and the conversation was, what does Pauline need to change in order to succeed in this organisation? And because I think I was seen as a little bit rough around the edges, perhaps was a bit anti-establishment. I like to have a laugh and didn't kind of conform to that corporate norm. And then somebody said, actually, this is the wrong conversation. We shouldn't be saying, what does Pauline need to change? We should say, what do we need to change in order to allow Pauline to succeed? And then that was reported back to me, and that was just a kind of such an inspirational thing to hear, actually, around how, and this is not just around being a female navigating through an organisation, it's actually about diversity and different styles and accommodating different personalities and not having to conform to this model of what a senior leader is. So that is something that I hope I can really instill in others as well.
No, I think that's a very important thing. I think we're going to finish the serious bits now. We're going on to a couple of less serious bits. What advice would you have given to yourself at age 18 or that you would have liked to have had?
Now, Marcia sent me that question in advance, and I really struggled with this one because I thought, well, you know, marry the right man first time round, perhaps is the first one. And I think not to worry so much, ignore the gremlins that just, you know, sitting on your shoulder telling you why you can't do something, I think would be my sort of more serious answer. And but then I think it's the advice at 18 is one thing, and then there's the advice at, you know, mid-30s is something else. Kind of, don't worry about your children because they're going to grow up all right. You know, I had a few two delinquent boys at one stage, and they've turned out brilliantly. So I tell myself not to give myself anxiety attacks about the peaks and troughs of your kids and the guilt that you go through because you're a working mum.
Everybody goes through it.
Yeah. Yeah. I don't know. I think I've had a very lucky life and a very lucky career, and I've benefited from, you know, a huge amount of people looking out for me, and you know, and I owe a lot of friends and colleagues a lot.
Yeah, and I think that is extremely important. I have one little story about women and children. When my children got to going off to university and disappearing, I started going on holiday once a year with my school friends again. And we had all taken different career paths. Some of us had stayed, gone into medicine, one had become a judge, or another one had given up and looked after their children and gone back very much to part-time work. And actually the first night, we hadn't seen each other for a while, we sat around the table and we were all massively guilty about all the problems our teenage children were having at university or at school or emerging. And it didn't matter where we'd come from, we all had the same guilt, and they all turned out absolutely fine in the end. So we went through that transition over the next 5-10 years, and it was you know, you suddenly realize, why did I go through all that?
Yeah.
And I think that's probably, from my perspective, one of the best pieces of advice you can give, especially during lockdown. We all feel it.
Yeah, be kind to yourself.
And there's no right way.
Yeah, no. I just saw a question pop up actually that said, what advice would you give yourself at 50? Well, I would say to the females, well, and to the males actually, I'm not going to make this gender specific, is learn about menopause and what you can do about it to manage menopause effectively. I think it's a taboo. I certainly didn't know anything about it. We weren't taught anything about it in medical school, and I had to really educate myself. And so that would be my advice to give myself at 50 is just educate yourself on menopause and talk about it as well. Demystify it.
So that's a big thing that the faculty's just started with the Medical Women's Federation, because we really want to invest more investment into women's health, of which menopause is a very big part, because the regulatory authorities do not recognise perimenopause as being part of needing hormonal therapy, which is an interesting challenge. So I think that's a very useful thing. What are you going to do when the pandemic's over and you are allowed to escape? Although I'm not sure we're going to be able to escape just like that. I think it's going to be a quite gradual release somehow. But what are you most looking forward to?
Well, I think I'm looking forward to big family get together. I see my parents, see my sons, and have a holiday. Yeah, I'm accelerating this. I'm signed up to volunteer as a vaccinator. I'm doing my induction training tomorrow, so I'm doing my bit to get those vaccinations out.
Well, we're doing pretty well. We're around about 20% of the country now, I think. So that's really really good. And well, I think we're coming to a point. I think, Marcia, we said we'd have about 15 minutes at the end to answer some of the questions. And there are a few questions that have appeared gradually on the chat box.
Yeah, so Rashona, right, she started the question flowing, and she wanted to know where did you go to university, and how do you manage your time and with family and children?
Yeah, so
and how were you hired as well?
Sorry, what was the last bit?
How were you hired? How did you get into GSK?
Oh, right, okay. So, well, I went to Cardiff University and loved it there. And so nothing but good things to say about there, and made some lifelong friends there as well, at least one of whom's on this call. And how did I manage raising children? Well, haphazardly, I think. They were somewhat, probably the most stressful thing in terms of managing childcare and managing travel as well, and some fairly shaky childcare arrangements at times, and relying on family and friends, and so yeah, it wasn't an easy thing. It was not like I had a house husband at home, and so that was not easy. They've left home now. They're in their 20s. And you never stop worrying about them, by the way. That's the other thing I've learned. And how did I get hired by GSK? Well, I mentioned that I'd taken that 6-month job in, it was Hazleton, became Bestseller actually while I was there, phase 1 unit in Leeds. And we did some work for Glaxo while I was there, and I just really hit it off with the team that were coordinating that study. And they phoned me up and said, would I be interested to join the phase 1 unit in Glaxo at that time. I mentioned that I'd gone to Leeds because that's where my fiance was. He'd just been moved down to Cambridgeshire, so again it just kind of worked out serendipitously. But I was just really lucky, and I think working in a phase 1 unit was perfect for me, because it was a bridge from clinical medicine, but it also allowed me to be part of designing a protocol, doing the study very hands-on and reporting it, and so it was a kind of good grounding, I think, for then stepping into more sort of project leadership roles.
Okay, and then from Patty, she's asking about how do you manage different opinions with your bosses?
Well,
that's a particularly interesting one, because, you know, he spoke about having diversity of styles and views.
yeah, that's a really interesting one. I mean, I think I would say probably I didn't for quite a long time. I think that's that sort of self-belief, and you just sort of sit and bite your lip and get on with it, and then, you know, you get yourself a bit miserable after a time when you haven't challenged something that you should have. And then I think somebody actually in one of my kind of 360 feedback said, oh, Pauline needs to put her head above the parapet. And I'd never heard that expression before. It was a completely new expression. And I remember going home going, what does that mean? And they said, oh, you know, you should get your voice heard. And you know, Flic, you and I talked about this. It's actually quite difficult sometimes when you've got a room full of people talking and you're trying to jump in, and you kind of, you eventually get in and you sound like you're screeching.
You don't have that depth of voice that some men do to project. And you start getting louder and louder, and people go, oh.
Yeah, and I have said that's an unexpected benefit still for me now, in terms of not wanting to sort of jump in and dominate a discussion, is the little hand function on Zoom and Teams meeting has actually really benefited me in terms of getting into a conversation. I think humour helps a lot, and I think actually I've also benefited from quite a lot of focus in the company I work for, in terms of really having kind of contracts at the beginning of meetings that people will be heard, and that people will be given a voice, and that if you haven't spoken, you'll be invited in. And also advice that I give when I'm mentoring people is, even if somebody has said something that you were going to say, you don't need to repeat the whole thing, but your endorsement of that point is super important, because I think then your voice has been heard and people know that you've got an opinion, and they'll respect that opinion. And the power of not only having supported that other person, but people having heard your voice, I think, is, because I used to think quite a lot of times, oh, the point's been said, so I'll just be quiet, and there'd be whole meetings where I didn't say a word. And that's not doing yourself any service, and it's not doing the richness of the discussion any good either.
I agree.
What I like about this conversation, actually, if I can indulge for a bit, is the fact that is your openness and your honesty, and it's something you said in your discussion about being this superwoman, and the reality is that, you know, none of us are superwomen. You're just trying to juggle so many different things. And sharing that honesty and that vulnerability is really important as well to those who are looking for ways of navigating, you know, the complex world of family and work, and, you know, having a different style to others. I think that's really important.
And men too. I mean,
it's for everybody. It's for everybody.
Yes.
Yeah. It's not gender specific.
Respecting. Yeah. It's respecting, juggling all of that, knowing that it's hard, and sharing that. Yeah.
So Roshana's had another question about, and I think you've touched on it, about how do you overcome shyness? Because you said that you're an introvert person.
Yeah. I mean, I'm much better now, and I remember almost, you know, is it the Myers-Briggs, and I came out sort of very firmly on the I introverted score there. I remember doing it again and kind of almost force-fitting the answers because I was determined to be more extrovert. But I still came out negative, so you know it's not to be fooled. And but I think oh gosh, I don't think you ever do overcome shyness. I mean, I still, you know, if I'm in a, I have to say, you know, the after event social gatherings and poster sessions still put a chill in my, you know, heart that you've got to go around and talk to people. But I think it's so I've actually got a ploy now, is that I will look around the room and find the person that's looking a little bit awkward and go and make a beeline for them and go and chat to them, because then that is, I kind of feel that I'm doing something that's a little bit out of my comfort zone. But they, you know, quite often I can see that they're looking quite relieved as well, that they're not the wallflower that I used to be, you know. And I talked about humour. I think sort of using if you've got a good sense of humor, then you can kind of connect with people and build relationships and be a little bolder as well.
Yeah. Yasmin is asking for advice. What would you tell young female scientists who are still studying to help them not to give up and to help them overcome lots of obstacles?
Oh gosh. I mean, I think it is just about and maybe you've touched on this, Flic, as well. I mean, I think it's about pacing yourself and not benchmarking yourself as well. People's careers go in different rates. And I think if you're comparing yourself with others constantly, you can feel that perhaps you're not making the mark or you're not going as quickly. And so, I mean, I think going at your own pace and working out what's right for you at that right time. And I think it's, you know, as I said, I'm 53, I'm about to start this coaching, and the homework that I've been given is to think the impossible, you know, write down what your ultimate dream, what, and then write down on alternate days what's holding you back from that. And I've done that exercise for a week now, and it's quite consistent that things that are holding me back are all self-limiting beliefs. They're all things that I could overcome. It's just my little voice telling me that, you know, I can't do that. And so I think it's, you know, if you don't feel clever enough, well, you can learn, you know, if you don't know enough people, you can network. I think it's just sort of define what it is that's holding you back, and really have a little strategy for how you can tactics for how you can overcome each of those. And you're not on your own, you know, get people, talk to people, introduce yourself to people, and let your aspirations be known, because that will lodge in somebody's head, and then when opportunities come up, they'll have you front of mind as well.
And I think that's very good advice. The networking piece is really good, and some of our parallel organisations will be running networking for young scientists. I think One Nucleus is doing a careers fair for young scientists. I'm not quite sure when it is, but it's sometime soon. And I think those sort of things are extremely valuable. And I think maybe, Marcia, we will be doing a bit more of that sort of thing for young scientists wanting to come, or at least to experience pharmaceutical medicine, maybe secondhand in discussions.
Yeah, and just to build on that, because networking again is like a word that sends chills into my heart because it's so kind of anti me. But I think if you kind of get a connection with one person, you can then make that person your advocate, and you can say, is there anybody else that I should be talking to? Could you introduce them to me? And so you're then getting a kind of network of people that, so you're not the person that's just cold calling somebody and saying, oh, you don't know me, but I'd like to have a career chat. It then becomes a bit of a cascade, and people are doing it on your behalf, which I think is, and people are much more likely to respond to a peer who says, oh, I've met somebody, would you mind chatting to them?
Yes.
Than just a sort of random email that appears in your inbox. So again, use people shamelessly.
And I think it's about applying your research skills to researching what's out there in terms of jobs, people, and things like that. But I agree, there are ways round it, very definitely.
So Amberine has asked, what would you recommend for undergraduates who would like to get experience in working in clinical research?
Oh gosh, well, I mean, I think, you know, a number of, I've got sort of limited experience. I've only worked for Glaxo that became Glaxo Wellcome that became GlaxoSmithKline. So I mean, I've got like not the broadest experience to call on, but I mean, I think there are schemes that many companies do in terms of either formal or informal attachments, and maybe that's something else that the faculty could you know scope out and highlight. I think what else could we do for undergraduates? I mean, I think talking more about this sort of the breadth of opportunity that sits across the pharmaceutical medicine profile, and I mean, you talked about this, Flic, in terms of how we can self-promote a little bit more.
Yes.
From the faculty perspective.
And I do think we can probably find placements amongst us to help on various projects, and we do from time to time take into transcript undergraduates to help out, and we try to teach them what's going on round and about. I have to say that one of my undergraduates was my son, who was then a scientist but then went off to run ski chalets, so it didn't do very much. It wasn't terribly successful. Yeah. But I think we have had more than one undergraduate in the office, and they've enjoyed it, and we've enjoyed having them. So I think we could probably do more of that sort of scheme round different companies and organizations, and I know some of the big pharmas do things like that, but perhaps we should be aware of that a bit better, Marcia, to help people. Yeah,
and summer interns as well. I've hosted quite a few, and that has been really good, because it's a win-win, because you know you're giving somebody some experience, but you're also bringing some much needed youth and vibrancy into your team as well, which is always lovely.
Yes. Oh, that's wonderful.
Right, and the last one from Patty, I mean, and I think she's just responding to the point you were making, Pauline, about, you know, as you advance in your career, and she's saying that she's at the point where she wants to move to high responsibility, but feels that she is not an expert in all things either. And that's the thing, you don't need to be an expert, do you?
I mean, listen, I mean, I headed up a unit in maternal and neonatal health, having done geriatrics. So, I mean, what can I say?
One extreme to the other.
Yeah, from birth to the other side. Anyway, we're coming up to the end. It's been a wonderful chat, and thank you, Pauline, for taking the time to speak with us, and thank you, Flic, for hosting and chairing, and thank you to everybody for joining the Faculty of Pharmaceutical Medicine on the International Day of Women and Girls in Science. And I hope you found a lot of inspiration from this fireside chat. Thank you, and I was going to say have a safe journey, but chances are you're all at home. So turn off carefully. And Will has just posted in the chat where you can find out more about the Women in Pharmaceutical Medicine project. Right, thank you.
Thank you.
Thank you so much.
Thank you. Bye.
Bye.
Thank you. Bye.
Yeah.